So we really believe that alcohol is a major problem in Northern Ireland. There has been a massive increase in alcohol-related deaths here. There's been a 54% increase in this over the last 10 years. Particularly worrying is that in the last year, the data has shown that the deaths are as high as 340 to 350. Now this is really concerning because that is the highest it has ever been. Research is emerging that perhaps this is related to the COVID pandemic and the lockdowns with increased drinking patterns. Here as a service, we really believed that we needed to do something about this, that we needed to try and reduce down alcohol-related harm, particularly try and make our mark on reducing alcohol-related deaths in Northern Ireland. So one of the things that we did here was that we contacted our hepatology colleagues. As we know, alcohol can affect the liver, and alcohol-related liver disease is a killer and one of the main killers when it comes to alcohol dependency. So essentially what we did was we worked with our colleagues who supported us greatly, and we actually applied for some funding in that area. The service managed to get funding for a fibroscanner, and this is something that has been really invaluable to us. The reason that we chose to get this is because a lot of people don't know that they have liver disease. People maybe don't even know they're drinking as much as they are. And also they don't know that they have the damage to the extent that they have it. So for example, they may have normal blood tests that show that their liver maybe isn't damaged or isn't showing the extent. And then when we go to do these tests, such as a fibroscanner, we're able to detect if they do have damage to their liver.
Over the last 2 years, we have been running dedicated fibroscanning clinics within our service to identify sort of potentially unknown liver damage. We have conducted well over 200 scans, and we have identified 20% of those have unknown sort of liver damage, and we have referred those individuals to our colleagues in hepatology for specialist intervention services and provided sort of counselling with regards to sort of that sort of diagnosis within our service. A fibroscanner is a piece of medical equipment that sends an ultrasound pulse through the liver to detect how stiff the liver is. It provides us with a score, and a score sort of over a certain level indicates that there is some damage to the liver. We can then sort of tell our patients that they do have a degree of liver damage and actually in some cases cirrhosis, which is sort of end stage sort of liver damage. And then we would sort of refer those patients on to our colleagues in hepatology for specialist services and input.
We have shown through our fibroscanning initiative so far that people may not know that they have this condition, liver disease, and yet this can reveal it and save their lives. Essentially, we can pick this up at an early stage and get them the intervention that they need. So Andrew has said that 20% of the people that we scanned didn't know it, but did have liver disease, some cirrhosis. So our overriding message to the public is, if there are any concerns about drinking patterns, any worries at all, it's always best just to seek help really at an early stage. Speak to your GP. They're the ones that will know exactly which service is best for you. And I suppose our message today is that get in there early and try and prevent yourself becoming unwell through alcohol. And our mission is really to try and impact the alcohol-related deaths here in Northern Ireland.